Hello, I'm Dr. Ralph Stockmann, chiropractor, and today we're going to talk about the relationship of vitamin D, calcium, osteoporosis, and cholesterol. Now, there are a lot of myths about these things, so today we hope to clear these things up. First of all, the lab tests for vitamin D, in order to say that you have a vitamin D deficiency, you require 4 blood tests: magnesium RBC, storage vitamin D, active vitamin D, and ionized calcium. Those 4 tests will tell you if you have a vitamin D deficiency. When your doctor tells you that you have a vitamin D deficiency based on only one of these tests, it's not very accurate, because vitamin D is actually a sign of chronic inflammation if it's low. So I'll say that again. Low vitamin D is a sign of chronic inflammation and a sign that you're low in magnesium, because magnesium is required to convert both forms of storage and active vitamin D to vitamin D. Vitamin D deficiencies cause symptoms like your bones aching, sweating of your head, loss of energy, and more severe forms cause bone deformation like rickets. Now, vitamin D being a sign of low magnesium, it's also a sign that you're high in free unbound iron. So you'll also want to get an iron panel to determine what your status is of iron and your hemoglobin level in the body. Now, vitamin D is activated by vitamin A, also called retinol, which is found in animal fat. So vitamin A is required to turn on the function of vitamin D. Vitamin D and calcium are not recommended as supplementation for osteoporosis, and I'll get into that. First, I want to say vitamin D is not present in breast milk. So that should tell you something. If the fetus is growing and after the baby is born, if you required vitamin D for that, it would certainly be in breast milk. Now, what is in breast milk is retinol, the vitamin A form that's required to activate vitamin D. So if you go out in the sunshine for 15 minutes a day with bare arms, bare neck and face, and bare legs for 15 minutes in the sun, you will produce 25,000 units of vitamin D. So you can get most of the vitamin D from your diet, from your food, and from being out in the sunshine. That's why it's hard to understand that in a country like Australia, where there's such abundant sunshine, why we would be deficient in vitamin D. Now, if you take vitamin D, it will cause an increase in calcium in your body. It will decrease the magnesium and also the salts, the sodium and potassium salts. It will kill off your vitamin A. It will decrease the production of ceruloplasmin, and it will increase the acidity, increase the pH in your body. So vitamin D supplementation is quite harmful to the body. Osteoporosis is actually a problem where the osteoblasts, which build bone up, and osteoclasts, which break bone down, where those two things are out of balance. Now, this is actually caused by excess unbound iron in the body. So the excess unbound iron decreases the activity of osteoblasts. So the bone formation decreases. And excess iron also interferes with the osteoclasts. So what you have is an imbalance in bone formation and bone breakdown when your body needs calcium from the bones. If you're an active child growing up, active in sports and playing, especially active girl, then your body will lay down calcium in your bone according to the amount of exercise that you get. So the more exercise that you have when you're young, the more calcium is laid down in the bones. The bones are like a calcium bank, so when your body requires calcium, it will take it out of the bones. So the osteoclasts will break down the bones so that you can use the calcium for other things in your body. Your bones also have a substance in them called lysyl oxidase, which makes your bones flexible. So your bones are actually made to bend a little bit before they break. What happens if you take supplements such as calcium, vitamin D, medications like Fosamax, or proton pump inhibitors, is that you will actually cause an imbalance in your body, and you will not have the lysyl oxidase, which is required to make the bones flexible. So people that take Fosamax, for instance, will have very brittle bones. Yes, it does temporarily increase the calcium in the bones, but the bones will become very brittle, and that of course is one of the major problems with the elderly, is when they have falls and they break their bones, the fat comes out of the long bones, the humerus or the femur. The fat can get into the blood and cause strokes. So the things that you need to supplement if you have a vitamin D deficiencies are magnesium, retinol, the vitamin A, and boron is also required to get the magnesium into the body. And the other thing that you will need to look at is to make sure that you don't have excess unbound iron, so the iron panel in a laboratory test.